Let's see, just a pop quiz. What is procedure number 1, Marissa? Oh wait, this is your first day, huh?
Yeah.
All right. What's procedure number 1 for trauma?
I'm not sure.
What's procedure number 1?
BSI,
BSI, PENMAN, perfect. You guys all wrote down BSI, PENMAN. You know where you stand with the BSI, PENMAN, right? What's procedure number 2?
General impression.
General impression, which consists of what?
Age, weight, sex, and position found.
Okay, there's more. Age, weight, sex, position found. What else?
Life threats. Assess for life threats.
Assess for life threats, okay. What else? This is a fail point that I told you guys about. Based on the mechanism of injury, what do you have to delegate your partner to do? Yes. Delegate your partner to hold manual stabilization of the spinal column, okay? Based on the mechanism of injury, for your final testing, we're going to give you a scenario. If we say the person had a skateboarding accident and just broke his ankle, does that indicate spinal stabilization? Probably not. If we give you a 2-story fall, does that indicate that? Yes, you have to make that decision or it's a fail point at procedure 2. That makes sense, okay? All right, you got the easy one. What's procedure 3?
Mental status.
Tell me about it.
You're seeing if they're alert, if they respond by being alert to your presence.
Okay.
Verbal, if they respond to your verbal communication with them. Painful, trapeze pinch on the same side. And unresponsive, just not responding to anything at all.
Perfect. Based on your mental status, AVPU, tell me about the first decision tree, ABC or CAB.
So based off of that, they have an altered level of consciousness and they became a first priority patient and it's a let it go.
So what I'm talking about is if the person's alert to verbal to pain, the next step is ABC. You check their ABC. Okay. If they are unresponsive, what's your next step? What's that? CAB. Perfect. That's your first decision tree. So when you come up, if the person's unresponsive, sir, are you okay? Are you okay? You check the circulation next. If they respond to you, you check airway next. Does that make sense? It's a huge difference, okay? All right, what's the next procedure, number 4? This isn't medical, this is trauma. So we just checked AVPU, right, mental status. AVPU, what did we just say? Alert to verbal to pain, what's your next step? What's your next step?
ABC.
ABC, perfect. Tell me about airway.
Open, clear, maintainable, and Newport suction.
One more.
Airway adjust.
Perfect, awesome. Open, clear, maintainable. If somebody is talking to you, can you determine if it's open, clear, or maintainable?
Yes.
Yes, right? If it's not open and clear, what do?
Open it.
You open it, you clear it, you suction it, you do whatever you can. You can't move on until you fix the problem. So if we give you a scenario, it's open and clear but not maintainable, what do you have to do?
I'll open it.
Fix it. If you move on to breathing, it's a fail, right? So make sure you know it's open. If it's not open, open it. Clear, if it's not, clear it, whether it be suction. That's why there's need for suction, right? If it's not maintainable, you maintain it by using an oral adjunct. Okay. What's next? Breathing, tell me about it.
Chest sounds or lung sounds?
Give me the order. What are you checking for? Breathing. No? What is it? Nothing? That's all right. Tell me about breathing.
The depth, you got the depth, the rate, breath, rate, depth, lung sounds.
No, there's 3. Rate, depth. You almost got it. Ease. Yep.
So ease and effort, and then lung sounds, and then the SpO2.
What about lung sounds?
Lung sounds, if it's deep, shallow.
You're assessing lung sounds, right? So it's rate, depth, ease, assess lung sounds. You said SpO2. What is SpO2?
SpO2.
What is SpO2? Level of oxygen in the blood. Okay, you're checking for that. And what's the final step for breathing? What is it? Initiates appropriate oxygen therapy based on those things that you find: rate, depth, and ease, SpO2, assessing lung sounds, okay? So rate, when I say rate, what am I talking about? Is it how many breaths per minute we're talking about? We're not counting for a minute. We're only assessing if it's fast, normal, or slow. That's it. It should take just a few seconds to determine that, all right? So what constitutes fast breathing? Running? Awesome. So what's a normal breathing rate? How many per minute? 12 to 20 is a normal breathing rate. You learn that in your vitals, right? So what would be fast? If 12 to 20 is normal, what's fast? Anything over 20 is fast. What would be slow? Anything under 12 is slow. What's normal? 12 to 20. So that's how you determine the rate. Is it fast, slow, or normal? Does that make sense? So you're determining that within a few seconds. You're just looking at the patient. Are they panting? That's fast. If they're agonal breaths, it's slow. Depth. In vitals, what did you learn? How do we describe breathing depth? Shallow, deep, or normal, right? And that's usually the effort that's placed into it. What two things how do we describe their effort, their ease? Labored or unlabored, right? Perfect. SpO2, you're going to learn this in vital signs. You're going to get a reading, the percent of oxygen in your blood. At what point are we concerned? What percentage? 94 and below, we start getting concerned. And it's progressive. At 94, you may place the person on a nasal cannula. At 88, you may put them on a non-breather mask. If they're having difficulty breathing at 88, you may place them on a bag mask device at 100% oxygen, okay? So that's your initiates appropriate oxygen therapy portion of it. If that makes sense, okay? So you have to know all of that under breathing. Where do we leave off? Circulation? Wait, did you do breathing? Yep, circulation. Circulation. This is your first day, never mind, all right. Not fair, all right. What are we checking under circulation?
Quality, rate, rhythm, skin color, moisture, temperature. There's one with the perhaps with the H. Per promoters.
Help them out, what are we looking for?
The life-threatening hemorrhaging and cut and expose. Or was I not?
Good, so rate, quality, rhythm, color, moisture, temperature for skin signs, capillary refill, cut and expose for uncontrolled hemorrhaging. You have to check all of those things, so let's break that down. Rate, how do we know if it's fast, normal, or slow? What is the normal heart rate for an adult human? 60 to 100, so what's fast? Over 100, what's slow? Less than 60, so that's your rate. Is it fast, normal, or slow, okay? You're determining that within a few seconds. Quality, what terms do we use to describe quality of a heart rate? Pulse rate, strong or weak, right? Rhythm, regular or irregular. If it's a regular beat, thump, 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 or is it skipping beats, that sort of thing, okay? And capillary refill, at what point is it considered delayed? Over 2 seconds. Now, there are some conditions that may make capillary refill delayed. What are some of those conditions? If you're cold, right? We're going to be out here. It's not cold yet, but it will be. If your hands are cold, elderly, if you're older, that sort of thing. Color, moisture, temperature. You learn that in your vitals. Make sure you know how to describe the person's color, the moisture level, the temperature based on conditions. If a person is laying out in the grass at 110-degree weather, should the person be pale and cool? No, they should be flush and warm, right? So you have to know all those things. And then cut and expose for uncontrolled hemorrhaging. In any one of those situations, A, B, C, if you find a problem, you have to fix it before you move on. Just don't forget that. So if there's uncontrolled hemorrhaging, you got to stop it. If the person doesn't have a pulse, you got to do CPR. If the person's SpO2 is low at 88, you got to initiate appropriate oxygen therapy before you move on. So each one of those contains a decision point that we're going to be interacting with you for your skills finals. That kind of makes sense? So that's your primary assessment. Your homework was to memorize the primary assessment. So if you have not memorized it, you are behind. You got to put more time and effort during the week, this week, because now we're going to move on to the rest of the trauma assessment, okay? And then next week, we're going to introduce probably Airway and continue on. So any questions on the primary assessment so far? So once you finish your primary assessment, what you're going to do next is your load and go criteria, your decision. This is an important decision point that you have to make based on the 3 load and go criteria. What is the 3 load and go criteria at this point? Altered level of consciousness, compromised ABCs. What's that? Hemorrhage, uncontrolled hemorrhage, perfect. If any of those conditions exist, you have to say, this patient is a load and go. You can't just say, I'm going to make a first transport decision. You have to physically or audibly say, this is load and go or stay and assess at this point, okay? And then you have your delegates. You delegate 3 things. I'm going to pick somebody at random here. What 3 things are you going to delegate?
You're going to delegate determining if they need a C-spine or a backboard.
We did that already.
Backboard.
Nope. Delegate your partner to do what?
Oh, delegate the partner to
Prepare the
prepare
backboard.
the backboard, if patient permitted. And then you're delegating the vitals,
Vitals, perfect.
and you're delegating sample.
Sample.
Determining the patient's history, or medical history.
Perfect, awesome. So take the vitals, including BGL. What is BGL? It's on your skill sheet, right? It says including BGL. So as you're going through your skill sheet, as you're going through your semester, if there's something on there that you don't understand, what should you do? You got to ask, because we can go the entire semester and you don't know what BGL is, and during finals, I'm going to ask you, take BGL, and you're like, what's that? So, what's that? Oh, perfect. Nice. Thank you for asking. Blood glucose level. Blood glucose level. I know now you're like, oh, I should have known that. But that goes for anything. If you don't understand, that's why we're here. Don't let those things slide, okay?